Earlier I mentioned the MAO inhibitors. We learned about MAOB inhibitors, and these are just monoamine oxidase inhibitors. Also an older type of drug. The prototype drug is a drug called phenelzine or Nardil. And once again, this is older, has lots and lots of unpleasant side effects. And so these are generally only used when no other drugs have been found to be effective for depression. Monoamine oxidase, as we discussed in chapter 9, is an enzyme that's made in the mitochondria, the powerhouses of the cells. And you find this enzyme in nerve endings. It also is found in various organs, and it works to inactivate all the major neurotransmitters because, of course, we don't want them just constantly functioning in the brain. Then all these reactions would just stop or keep going and never stop. So we have naturally occurring enzymes that are going to kind of inactivate all these neurotransmitters for when they're not needed. Now, this is great and it's a normal function, but when you are lacking sufficient amounts of these neurotransmitters to keep your mood elevated, then this enzyme is getting rid of neurotransmitters that you need. So what we have are monoamine oxidase inhibitors. They block this enzyme so it isn't able to work on inactivating the neurotransmitters, and that makes them more available in the little synapses between the nerves. Now, the bad thing about MAOIs, if you remember from chapter 9, is that they don't react well with certain amino acids or natural amines, and some of these amines have a vasopressor effect. Now, vasopressors are drugs that are used in the ICU to raise heart rate and blood pressure. They use these when the person is in hypovolemic shock, they've lost a lot of blood, or they're in septic shock, and they keep the blood vessels narrowed so that the heart rate and the blood pressure can increase until the sepsis can be brought under control or blood can be placed in the person's body. Now, because these vasopressor amines work naturally in the body, they're available, and these drugs that inhibit MAOs don't work well with tyramine and a few of the others. So on page 269 in the textbook, 269, I don't think so. 203, sorry. 269 must have been in the previous textbook. Let me just fix that right now. But these medications, when interacting with those amines, can cause the blood pressure to just skyrocket. Hypertensive crisis, and the person is going to be at increased risk for heart attack, stroke, all kinds of bleeding problems in the brain. On page 199, you'll see some of the MAOIs, and there aren't many left anymore. The ATI book talks about them on pages 54 to 56, and you need to make sure to read that patient and family teaching on page 204. Also look at those high tyramine foods that you should avoid. These drugs can cause some GI problems, headache, they can make you sleepy, cause a lot of dry mouth problems. Adverse effects can be liver damage, blood disorders, and possibly increased thoughts of suicide, and that's thought to be more from increasing the person's energy than actually doing anything to the neurotransmitters. The MAOIs do not work and play well with the other children. You are not going to be able to find a drug that really mixes well with MAOIs. Every single drug commercial, when you start rattling off all the drugs that don't work, MAOIs are one of them. So you don't want to combine an MAOI and an SSRI like Prozac, or an SNRI, or St. John's wort, which, like we said, naturally increases serotonin. Make sure you read Nursing Implications and Patient Teaching on that table on page 199, those bullet points, and see what we're told to tell patients and families. If a person has to go off an MAOI, they should be off that drug. They should wean off of it, and then they should be off it for at least 2 weeks before they start another drug that increases serotonin, because of those serotonin syndrome risks. This is just a picture of some of the drugs you might see with MAOIs that are dangerous. They contain tyramine, so your aged cheeses, your processed meats, your red wines, other things like chocolate and cola and certain kinds of beans and dried fruits. In other words, a lot of fun foods are going to give you problems with your MAOIs, and that's one of the reasons why people find them difficult to stick to.